when it comes to oxygen, these are the main masks we use. We got the BVM, it's a bag valve mask for ventilation. Over here, we got a nasal cannula. It's typically the mask you use with the lower amount of oxygen with the patient. And then if a patient requires more oxygen, we're gonna use a non-rebreather mask right here. If y'all notice, I'm wearing my PPE right now. If you have any contact with the patient or equipment, you always want to wear PPE. So the first thing we're gonna do with the nasal cannula, so we're gonna connect this side of the tubing, and we're gonna connect this like that. Perfect. And then let's just say this patient needs 2 liters. So since this patient needs 2 liters, we're gonna turn this dial right here and we're gonna change it to the number 2. So right now it's blowing at 2 liters per minute. So the oxygen is flowing through the mask right now. So now we're gonna connect it to the patient. So the first thing we wanna do is we're gonna lower this neck strap part like that. We're gonna try to lower it all the way down. We're gonna connect it on the patient now. Just gonna take this part, and then we're gonna go over the ears. We're gonna make sure that it's in the patient's nose. And then once you finally got it secured on here, you're gonna tighten up the strap. All right, so patient's connected. All right, so this is the non-rebreather mask. So basically same concept. We're gonna connect this part on here. And then for these masks, we typically like to use 10 to 15 liters. So we're gonna turn it up to 15. All right, so it's at 15. And one of the most important parts is you wanna make sure this bag is 2/3 filled. So we're gonna hold this and make sure it's filled up. Right now the bag is filled, so it's ready to go. All right, and then we're just gonna put this over the patient's head. So we're gonna lift the patient's head up. And we're gonna put the mask over, just like that. We wanna make sure we have a nice seal, so we're gonna tighten this on the nose right here. Make sure it's sealed, and then we're gonna pull these shut. So it's secured right there. Alright, so this is the bag valve mask, the BVM. Alright, so we're going to ventilate a patient, but we're also going to connect it to oxygen. So we have our connection right here, you see right here, and it's kind of like the same thing as the non-rebreather. It's going to have a bag with it. So we're going to connect this to the oxygen. Alright, we're going to set this one at 15 liters. Alright, now we're at 15 liters, and then this bag is going to start filling up. Alright. And then to ventilate the patient, we're going to have our handle right here. And the mask is going to be facing this way. And we're going to ventilate our patients. And we're only going to push the bag about like less than halfway. We're not going to go all the way, okay? We're just 2 ventilations. That's how you ventilate a patient with oxygen.